Patient education is really important when it comes to implants and restorative options. An educated patient can say, okay, practice A is giving me a better price, but they're cutting corners here and here and here. I've been through this journey enough times with enough patients that I know that really all we're doing is this technical fixing of this, but emotionally it spreads to every other part of their life, and it's just phenomenal to see a patient come back to life and get themselves again where they lost themselves for a while. So I've had patients come in saying, I sneezed and my denture came out into the Kalua pig in our Hawaii luau, and I was so embarrassed that it ruined my whole vacation. And so people who wear a denture, when they go out to a restaurant, they don't say, what do I want to eat? They say, what can I eat safely and not have this embarrassing situation come up? An all-on-6 stands head and shoulders above any other tooth replacement for several reasons. Number one, all those things that can happen with a removable set of teeth are gone. Talk to somebody that has an all-on-6 and they can eat anything they want. Implants are made out of titanium. For whatever reason, our bone likes titanium, and so we put those titanium foundations down in the jawbone where the tooth roots used to be, and that bone just attaches to it. And so that's why we feel confident that if a patient has their titanium implants with a really nice, beautiful zirconia bridge on top of it, that thing is going to be able to eat and chew whatever that patient can throw at it. How do we customize somebody's smile with implants so it's going to look like it belongs to them? What we do is, number one, listen to our patient and make a set of temporaries to go on their implants, and so we can use it as a gauge to know, what do we think about the color, what do we think about the size. If there's changes that need to be made, we'll go through a repeat over and over and over with new temporaries until we get it right, and then once we've got it, then we move to replicate that in zirconia, and they love it. Maintenance is an important part of maintaining health. After we get rid of all the bad that's going on in somebody's mouth and replace it with all this good stuff, we want it to stay good. They've got to come in and get them cleaned every 4 months. We've got to get x-rays once a year to make sure that we're checking the health of the bone around those implants. And we make sure that somebody knows that using a water pick underneath is a good way to clean underneath there. We just partner with our patients and make sure that together we're keeping them clean so they can't have new problems arise around them. The way that we figure out what's going to be most appropriate for that patient is we listen to them. We talk about what their goals are, what their diet is. When we get to the end of the road and everything's fixed, what really do they want us to have accomplished? So the way we help our patients feel confident about their treatment choices is asking them if they'd like to see, what does this look like in somebody's mouth? And so we'll contact one of our patients that has had that treatment done so they can talk to that patient, see what it was like, see what it looks like. Some people don't care. They're just like, let's just do it, I trust you. And other people are like, show me 10 patients. So I've had so many patients through the years say, I'm probably the worst you've ever seen. They're just waiting for us to judge them, to laugh at them or make fun of them or whatever. And then they get to know us and realize, we know you're a human being. We know that your situation is what it is, and we're here to get you out of it and to fix it. Just give us a chance, come in and get to know us, and you will find that you're not judged and that there is hope for you to get back to the life that you want.